there has been a successful and significant reduction in new infections in Nigeria. We've been able to reduce the prevalence of HIV/AIDS. Once upon a time it was as high as 3.6, thereabouts. Now we have 1.4% of the population living with HIV/AIDS. We've been able to increase the percentage of people living with HIV/AIDS on treatment. Now, out of the 2 million estimated Nigerians with HIV/AIDS, about 1.6 million of them are on antiretroviral drugs. We've also been able to keep at least about 98.6% of Nigerians free of HIV. So that means that at least majority of our population are living negatively. They are living free of the HIV virus. And we've also been able to reduce the incidence of new infections. Now in the last 10 years, the rate of new infections is going down, even though we expect it to be steeper than that, to be able to meet the global target. But there has been a successful and significant reduction in new infections in Nigeria. NACA, as you know, is an agency established by government to coordinate the multi-sectorial national response. As we interact and relate with our donor partners, international donors, we relate with the implementing partners, we relate with the civil society organizations, non-governmental organizations, faith-based organizations, and even the traditional rulers and community leaders, and even with people living with the network of people living with HIV/AIDS. And what we've been doing in this regard is to also resource mobilization. Aside from the donors, donation we receive from our international partners, we are resourcing funds locally, from budgetary allocation. And we've been able to successfully increase our budgetary allocation for HIV commodities. Aside from this also, we are also looking at local production of HIV products. We've been able to engage some big pharmaceutical companies and signed even MOU with some companies outside Nigeria for technology transfer, for them to start local production of HIV products like test kits, rapid test kits, like condoms, and even like antiretroviral medication. And all this, I want to appreciate the government of the day, President Bola Ahmed Tinubu, for creating the enabling environment. There is this policy, this executive order that talks about tax-free, tax exemption for pharmaceutical products, for pharmaceutical equipment and materials, and this is kind of motivating to the production, to the producers, and also the issue of there's a presidential task force on unlocking the value chain, PVAC. And this this committee, we've been working very closely with them to attract investors for local and domestic production of HIV commodities. In the last couple of years, we embarked on what we refer to as getting the data right. And what we meant by that is that we were cleaning up our data. For some time, our data were not even published, internationally, because we had some dichotomy, we had some discordance. But now what we engage with our partners is to clean up the data. And what are we doing? We're trying to eliminate the duplicates, because sometimes some people register in Abia State and then they will travel to Lagos State and they'll go and register there again, and then we have duplicates, the same person on our database. And then of course there were some that were dead and the data was still on our database, and so many other things like that. So we engaged on this and we embarked on this. So we were able to clean up our data. We were able to introduce what we refer to as biometrics capturing. So we were capturing using the biometrics, and all this is to ensure that the data we have is accurate, and also we encourage data reporting from the health facilities to our database, data central data warehouse, so that we can actually be able to track the data and ensure that we have one coordinating data. The World AIDS Day 2024, the theme is taking the right path, sustain the gains, with particular emphasis on mother-to-child transmission and on pediatric age group. We say take the right path because we want to ensure that we leave no one behind. We want to ensure that every Nigerian has access to testing, counseling and testing of HIV. We want to ensure that every Nigerian that is HIV positive has access to care. We want to ensure that people can actually take their medications and be virally suppressed, irrespective of their status, irrespective of their age, irrespective of wherever they live across Nigeria. We want to reduce the transmission of mother to child by making sure that every pregnant woman is tested and if found to be positive, they are put on care, and we ensure that no child is born with HIV virus.